Sickle Cell Action Network, a weekly internet radio show presented by Martin Center Sickle Cell Initiative and sponsored by Ashe Therapeutics. We're coming to you live from Indianapolis, Indiana. We're here to serve you by providing up-to-date information and opinion on all matters pertaining to sickle cell disease. My name is Gary A. Gibson, and I am your host for the next 2 hours. Let me start by saying that I don't have sickle cell disease, nor do I carry the sickle cell trait. In spite of that, I am no stranger to sickle cell. Quite the contrary. You see, even though I don't have sickle cell, it has had a very huge impact on my life. That's true because its complications took my wife from me after 12 years of marriage. It also caused her to have a miscarriage that resulted in the loss of our twin babies that she was carrying while in a sickle cell crisis. So all told, sickle cell has taken 3 lives from me, and I feel the pain of those losses every single day. I currently serve as President and CEO of Martin Center Sickle Cell Initiative, a community-based organization that has been serving people with sickle cell for over 45 years. Each day, I attempt to transform the pain of my losses into positive energy that is focused on making a difference for those who are battling sickle cell. From being involved with sickle cell for over 40 years, I'm able to say that much progress has been made, but there is still so much work to do. This show is an opportunity to contribute to the ever-expanding dialogue about sickle cell that is taking place all around the world. Our show is about raising awareness, but it is also about so much more. I like to say that sickle cell awareness is important, but we need more than awareness. Those living with sickle cell are already aware. That makes me ask, so what are we doing for them? My answer is, not enough. That's why we've named this show the Sickle Cell Action Network, because awareness without action has very little impact. We want this show to be a source of information and a call to action to help those who must live with sickle cell in their midst. We've designed this show to provide information that is beneficial to patients, caregivers, family members, and friends alike. Most importantly, we want people with sickle cell to know and understand that they are not alone. The Sickle Cell Action Network show features live guests who are healthcare providers, patients, advocates, and others who are engaged in the fight to eradicate sickle cell and ease its burden on those it affects. Today, we are pleased to have 3 very special guests who will speak with us about raising funds for sickle cell. Joining me today in studio are Sabae Martin, Annette Johnson, and Jami Fox. Ms. Martin is the Treasurer of the Sickle Cell Board of Directors, Ms. Johnson is the Chair of our Fundraising Committee, and Ms. Fox is one of our active sickle cell patient advocates. We're very happy to have them all here with us today. Before we get to today's topic, however, I want to share some of our upcoming topics with you so that you know what we're going to be doing. In future weeks, we will cover such topics as sickle cell's narcotics dilemma, traveling with sickle cell, connecting the sickle cell community, and many, many others. So as you can see, we're serious about sharing valuable information, and we hope that you will join us every week, same time, same station. If you've missed some of our previous editions or wish that you could listen to them again, don't worry. Just go to the Martin Center Sickle Cell Initiative YouTube page, and you'll find them there. Now let's get on with our show, and we'll start with this week's edition of Sickle Cell News Update. On our update today, we got 3 stories, or 3 articles. One of them pertains to a doctor that recently participated in our 2016 Indiana Sickle Cell Conference, and I'm really glad to see that she's getting this kind of notoriety. The story, or the article headline, is MUSC Doctor Looks to Shed Light on Sickle Cell, and it is coming from the Post and Courier in South Carolina. And the article reads, Shantae Kane has to drive 80-plus miles from Somerton to see an expert at the Medical University of South Carolina to get her sickle cell treatment. And when the sickle cell-shaped red blood cells in her body painfully clog the blood flow, Kane oftentimes has to go to the emergency room at Clarendon Memorial Hospital in rural Manning, followed by another long drive to Charleston for further treatment. MUSC, or Medical University of South Carolina, is trying to make life easier for her and other patients with sickle cell diseases by setting up satellite clinics or spokes across the state with the launch of its new program, SC Squared. Julie Cantor, the director of the MUSC Sickle Cell Disease Center and the one who spoke at our conference just recently, said the first spoke will be based in Columbia and is set for a June startup. From there, the hospital eventually expects to have offices for sickle cell patients in Beaufort, Florence, Georgetown, and in the upstate. The hospital is also working to improve emergency room care for patients through individualized care plans it is putting in place at Columbia, Beaufort, and at Tidelands Health in Georgetown. We see a lot of patients here at MUSC that drive hours to see us. So what we want to do is get that care closer to their communities, Cantor said. In addition to the pain that sickle cell causes, victims may experience swelling, spleen damage, fatigue, and vision problems. Despite the efforts of MUSC, Cantor and Kane both expressed frustrations with the lack of national attention being paid to sickle cell disease, even though it is the most common blood-inherited disease in the nation. There is no federal registry for sickle cell, which makes it difficult to understand the number of patients dealing with the disease and those who ultimately die from it, Cantor said. The Centers for Disease Control and Prevention reports roughly 100,000 Americans live with sickle cell, though Cantor says there are a lot more, including an estimated 4,500 patients in the state of South Carolina. I agree with Dr. Cantor, by the way. MUSC has seen about 1,900 sickle cell patients over the past 5 years, including 1,100 that are being seen at the Sickle Cell Disease Center. Another issue plaguing sickle cell patients is that there is only one medication, hydroxyurea, that is approved by the Food and Drug Administration to treat sickle cell. That's fairly pathetic, and we need to do better, Cantor said. Cantor also addressed the lack of funding directed towards sickle cell both in public research and among private entities. She explained that sickle cell is 3 times as common as cystic fibrosis, a disease that causes damage to the lungs and digestive system. However, sickle cell only receives $1 for every $70 cystic fibrosis receives in research funding. Sickle cell disease mainly affects black patients. Cystic fibrosis, by comparison, is much more common among white patients. For Kane, another battle she's experienced is an unfair stigma that is placed on sickle cell patients. Many people peg them as drug seekers, Kane said, because they often require medication to alleviate the pain they feel when they're having an episode. If I could give you 5 minutes in my shoes when I'm having a full-blown crisis, you would beg me to take the medication because it's just that hard to go through, she said. Well, we want to congratulate Dr. Julie Cantor for her work in trying to establish the spokes for treatment for people with sickle cell disease there in South Carolina. She's an awesome individual. Not only is she a good doctor, she is also a good advocate for people with sickle cell disease. Our next story is about an international sickle cell symposium that was held just a few days ago. And this one had 15 countries represented. And this year, Uganda hosted the 6th International Symposium on Sickle Cell Disease in Central Africa. The conference, which is the largest that has been organized on the continent, sought to address the sickle cell disease burden in sub-Saharan Africa. It ran from 25th to 27th of May under the themes Accessible Treatments, New Technologies and Innovations, and Break the Silence. Charles Kiyaga, the chairman of the Sickle Cell Disease Research Network in Central Africa, said that in preparation for the conference, the Director General on Health Duties, Ruth Jane Achieng, appointed a team of 30 members. The team has been sitting every week since November last year to ensure the success of the conference. Meanwhile, Kiyaga also disseminated findings of the screening that was started in April last year in 7 districts in Uganda, and those districts are Gulo, Lira, Kitgum, Oyam, Dokola, Jinja, and Kampala. He says we have screened 50,000 babies in the past 5 months. However, he noted that ignorance is still a big problem in addressing the problem, and so sensitization, I hate that word, has to continue. While we're doing screening in the districts, it was a pity that most of the parents did not know that their children were sick. Sarah Opindi, the State Minister of Health, added. Opindi went on to say that the disease has been neglected in most countries, including Uganda. We cannot continue talking about lack of resources. Resources are there if we prioritize, she said. Kiyaga hopes that the conference would also attract support for the Declaration for Sickle Cell in Sub-Saharan Africa. Currently, there is a declaration on non-communicable diseases, but we need one on sickle cell as well, he stated. So, good news to see that Sub-Saharan Africa is convening for conferences on sickle cell disease. The last story is the New York Blood Center's Laboratory of Complement Biology receives a National Institute of Health grant to study mechanisms controlling transfusion-associated antibody responses in sickle cell disease. The New York Blood Center's Laboratory of Complement Biology received a $2.3 million grant from the National Institutes of Health, the NIH, to study mechanisms to control successful transfusions in patients with sickle cell disease. NYBC is a leader in the research and development of novel transfusion strategies to combat the devastating effects of sickle cell disease. Now, this is a very difficult name. Dr. Karina Yazdanbakish, who I will forever called Dr. Yaz. Head of the laboratory and member of the Lindsay Kimball Research Institute, will observe how patients with sickle cell disease respond to life-saving blood transfusions. More specifically, Dr. Yaz will investigate the process by which maladaptive antibodies reject transfused cells, helping to mitigate patient side effects with these advancements. So we want to thank the National Institutes of Health for providing a $2.3 million grant to the New York Blood Center so that they continue to research to improve the outcomes of sickle cell disease patients who take transfusions. That's it for the Sickle Cell News Action Network today for our news update, and we are going to take a break, and when we come back we will start speaking about fundraising for sickle cell with our three wonderful guests. This is the Sickle Cell Action Network. I'm Gary A. Gibson, your host. Cell disease. My guests today are Sabae Martin, who is the treasurer of the Martin Center for Sickle Cell Initiative Board of Directors, Annette Johnson, who is the chairperson of the Martin Center Sickle Cell Initiative Fundraising Committee, and Jami Fox, a fundraiser extraordinaire. And I'm very happy that they're all here today, and we're going to ask them some questions. We're going to be talking about raising funds for sickle cell. We're going to talk about some of the challenges and some of the successes. And the first thing, as always, ladies, first of all, welcome to the Sickle Cell Action Network, Jami.
Thank you. I'm glad to be here.
And Annette, thank you for coming with us today.
Oh, thank you as well, Gary.
And Sabae, not last but not least, thank you for being
Gary.
here today. So we always like to give our audience an opportunity to learn more about who they're listening to. And we'd like each of you to tell us a little bit about yourselves, where you were born, and have you always lived here in Indianapolis? And let's start with you, Sabae.
Well, yes, I was born in Indianapolis. I grew up here. I went to high school here. I moved to Dallas, Texas in 1980 and had the pleasure of moving back to Indianapolis in about 2010. I went back to Dallas for a couple of years and then finally moved back in 2012, making Indianapolis my home.
All right. And what about you, Annette?
Well, I was born in Louisville, Kentucky, so I have a lot of family and friends in, I would say, Louisville, Kentucky, as well as here in Indianapolis, Indiana. But I've been in Indianapolis just about all of my middle school years.
All right. And then Jami, what about you?
Yeah, I actually was born in New Orleans, Louisiana.
Oh, you were?
Yeah.
Okay.
And then I lived in French Lick, Indiana until I was about 10.
Yeah.
So Indy is my home, basically, because I've...
Now, for people that don't know, French Lick is not very well populated with people of color. Is that correct?
Yeah, that's pretty correct.
Yeah. Okay, well, I'm glad you survived your experience there in French Lick. It's also now a hotbed for gambling,
Yes,
which is something
it is.
that has helped revive that area. Jami, you're a sickle cell patient advocate, and you're also becoming, like I said, quite a fundraising machine. So tell us a little bit about your hemoglobin type.
So I have sickle beta thal, which is basically a version of the sickle cell that still is as painful and as terrible as sickle cell anemia. So
Yeah. Okay. And I'm not going to ask the other ladies, but I'm going to ask you because it kind of always relates with sickle cell. How old are you?
I'm 34.
Very good. Thank you for sharing that. In your own words, how would you describe what it's like to have a sickle cell crisis?
Man.
I ask this question a lot too.
Yeah, it is so indescribable, but the only way I can say is that basically the pain feels like what it's doing. I mean, you feel like your blood cannot get through your veins.
Okay.
And it just feels very like almost like a throbbing sensation, but like times 100. And it is it's the worst pain that you could ever feel.
So you've had some other kinds of pain, right? Just like everybody else.
Sure.
So when you equate it, there's nothing like it.
No. There's nothing
that's
that
what
you
people
can put next to it.
pretty much always say.
Yeah.
That makes you a pretty strong warrior, and we're glad that you are the warrior that you are. Sabae, I'm going to ask you because, and you'll get to talk a little bit more about this too, but how do you describe sickle cell? And why don't you share your connection to sickle cell?
My connection with sickle cell came about through a family member who has sickle cell. My uncle called during a time that they were or my cousin was going through a crisis, and he had become so frustrated with the system that he felt he needed legal help. I am a paralegal by profession, and it was one of those cold, snowy nights in Indianapolis that I got up, put my coat on, and went out to the hospital. What I experienced was a process of nothing. They just were not interested in helping my cousin, and it was very frustrating for her. That night I learned that sickle cell was the David, was the David, and the hospital system was the Goliath. And so we fight these kinds of battles for those who would fight normally and do fight in just the challenge of sickle cell. But when you have a system that is set up that's supposed to be there for them and is not there for them, it's very frustrating. Mm-hmm. We escalated as we should. When you advocate, we went as far as a state rep, and we still had to wait till the next day before anything was actually done. So very, very frustrating. And all of this happened while she was at the hospital where she had delivered all 3 of her children, and her hematologist was there. All of her records were there. I didn't understand why they could not help her.
And that is what generated the passion that you still have.
That just was not fair. It didn't make sense, and something had to be done.
Right. And now, Annette, what about you? How would you describe sickle cell?
I would start off by saying just understanding the disease itself. I'm an educator by trade, and my whole theory is if you're an educator, you should be out in the community educating others. Just recently, since I got started with the Martin Center Sickle Cell, I found out, again through education and asking questions, that a couple of my relatives carry the trait. So that has also sparked the interest in me as well. So I would say that's pretty much how I would describe it. Just, being an educator, and I think it's my duty to be out in the community and making sure that I carry the torch of education.
But you yourself don't have trait?
Well, that's to be determined.
Okay. So you haven't tested?
Right.
Okay. You need
but
to
that's
test.
To be determined. And
Right.
my mom had shared that with me as well. She is pretty sure I may have the trait because quite a few of our family members carry the trait.
You definitely should go
Most
ahead
definitely.
and get your screening. Okay, so Sabae, you're the treasurer, as I said, for our board of directors, and you're fulfilling that role with a tremendous amount of passion. You told us where the passion came from. What is it that helps you sustain that passion?
The one statement that comes to mind that pushed me into action was the first conference that I attended. As Annette said, education is important. You have to know why. And I believe that people will give and they will be concerned and believe in what your challenge is if they understand what it is. And that statement was that there has not been any meaningful medication that's been produced since sickle cell was discovered in 1910. Mm-hmm. In 1910. Mm-hmm. That made no sense to me. We have medication for almost every malady that exists or some sort of treatment. And you hear people say, well, it's because it's a black disease, and I don't like to think of it that way, but it seems that way. I like to think of it as it's just the numbers. We cannot produce that $1 million or $1 billion medication for one of the large pharmaceutical companies to make their billions off of. But unfortunately, history has taught us that it is not a priority for pharmaceutical companies to find a cure.
I absolutely think you're right on both points, but I think they're almost equally rated. So in other words, the lower number of patients probably is not something that causes people to feel like we've got to do something about it because it's not such a big deal because there aren't that many people affected. But I also think a very big part of it is the fact that it has always affected mostly people of color, and people of color actually, all you have to do is look at the history books to see what kind of treatment people of color have gotten. But I will say that what you see is a tremendous activity now with the pharmaceutical companies and a lot of the providers who are wanting to know more about sickle cell, and particularly the pharmaceutical companies who are engaged now in at least 15 different trials for products for sickle cell disease. And I think the thing is that they have recognized it more on a global scale and less on a United States of America scale. And when you compare the two, you see that with as many as 25 million people in the world with sickle cell disease, there's a market all of a sudden. That 100,000, when we talked with Brian Coley, the president of Mass Therapeutics, our sponsor, a few months back, and he told us, that it costs billions of dollars to bring a drug to market. Okay. So you have to look at what's your return on investment. And I think for all of these years, from 1910 until about probably maybe 2005 or so, most of the pharmaceutical companies didn't see the global picture. Right. Now they do, and all of a sudden there's more activity than ever before because they recognize, that ROI can come back a whole lot faster now that there's 25 million people. So I think you're right on both counts. Annette, you're a very engaged community activist. I can't even keep up with you, and I try watching what you're doing, and I still can't keep up with you. You're an elected official. You're a member of our board of directors. You're in a lot of demand in our community, and quite frankly, there are a lot of other things that you could be doing with your time. Why are you so passionate about sickle cell?
Well, Gary, thanks for that question. I was sitting here thinking about that, and some things came to my mind. First off, I'm a graduate of Martin University, and from that particular experience with Father Hardin, and I know that he was the founder of the Martin Center, right. And just in our teachings and the classworks that we did there for the 6 years that I was there, that was our charge, was to give back to the community.
Right.
So in my later years, I thought about that. I'm like, I'm supposed to be giving back to the community. I'm supposed to be doing something. What better organization would it be except, the Martin Center Sickle Cell, since I graduated from Martin University. So that's where it sparked the interest. And then another portion of it is a good friend of mine that's sitting here with me as well, Sabae Martin. And when she, pretty much came to me about us working together, it seemed like the two connected. I was like, yes, I'm supposed to be doing that anyway. I just kind of took a break and hadn't worked on that pathway, because all the teachings that I got and the learning that I got, the foundation from Martin University was community, working in the community, giving back, being an advocate.
Right.
And of course, that just sparked a whole learning institution in me. I was able to go on to Ball State and get a master's degrees there as well.
Okay.
Several master degrees, but again, that just sparked the interest. So my passion is I'm supposed to be giving back as a servant leader, and that was one of the classes that I took that just kind of was an eye-opening experience for me. So
thank you for
that's
that.
where it started. A lot of people now, that will be my new, that's what I will tell people, but no one has ever asked me that, and it made me sit and think, well, how did I think to come to this? But that's where it came from, Father Hardin.
I have a tendency to ask questions that nobody thought about.
Yeah.
But for those that are listening, Father Boniface Hardin is the founder of Martin Center. It was founded as Martin Center in 1969, and we took the name Martin Center Sickle Cell Initiative in 2012. Father Hardin had a vision of helping people that were disadvantaged. He was sought after by many of the elected officials. He gave counsel and guidance to many of them, many names that you have probably heard. And then he founded Martin University. So Martin University actually is a spin-off of Martin Center. So thank you for that information. Jami, I'm going to ask you a question. You've lived with sickle cell all your life, and only a smaller percentage of our population can understand what that's like. In other words, only people that have sickle cell disease. Right. If you don't mind, how would you describe your life with sickle cell?
I would describe it as, now in my 30s, I'm a planner. I try to plan ahead.
Okay. We talk about that a lot on the show too. Proactivity. Go ahead.
Yeah, I try to plan so I do not get sick, because who wants to be sick, right? So I try to plan my days, my weeks, so I do things for my body that are good.
Mm-hmm.
And even with like my pregnancy, trying to plan a pregnancy, I wasn't going to be the person that just got pregnant all of a sudden. Like everything, I feel like with sickle cell, you have to have some type of plan for it, because it comes when it feels like.
Right.
And so if you plan ahead and not try to make it come, not try to make the pain come, then I feel like I'm doing something for myself that's good. And so planning ahead is definitely how I have to live with sickle cell now, because if I don't, then I'm away from my family and my child, and I don't want to be away. I don't want to be in the hospital, and I honestly don't want to have pain. And so even though I know it comes, but I just try to plan, and I try to manage the pain at home so I don't have to go to the hospital. And so I feel like, living with the sickle cell, I just try to be the best planner of my day and days ahead.
And I think that's a great lesson that we hope people listen to. And proactivity is so important. Generally, you learn what your triggers are.
Right.
And you then try to plan around it so that you don't deal with those triggers. You don't even let those triggers happen as best as possible. But as you said, sickle cell disease, the nature of it is no matter how many plans, it can still crop up and rear its ugly head.
Yeah.
Ladies and gentlemen, we're going to take a break, and then when we return, we'll continue our discussion with the three outstanding ladies talking about fundraising for sickle cell.
Ashe Therapeutics is leading the way in developing treatments for sickle cell disease. We're proud to sponsor the Martin Center Sickle Cell Initiative in its mission to provide leadership, education, and support services to the sickle cell community.
What's next, Jamie?
Welcome back to the Sickle Cell Action Network. I'm Gary A. Gibson, your host, and we are talking with Sabae Martin, Annette Johnson, and Jami Fox, and we are soon to get into the topic at hand, which is raising funds for sickle cell. Still setting the stage for that a little bit, though, so I'm going to go back to Jami. Jami, we've often talked on the show about how so many sickle cell patients tend to keep their condition a secret from others. Did you used to be that way, too?
No.
No? You never have been?
I've never been that way.
Okay.
I have always, like, even with dating and friendships in general, but especially with dating, I've always been upfront and, like, told the guys, that this is what's going on. Like, I was just open about it, because I didn't want anything like all of a sudden I fall in love.
Right.
And,
Right.
oh, actually I have sickle cell, and if they had the trait or disease, then where would we be?
Right. Right.
And I always knew I did not want to pass along this disease. And so I think that's why I've always been so upfront, is because I didn't want to pass along, to have another baby.
Right,
So
right.
that was always my thought
Well,
process.
I applaud you for that.
Thanks.
How did some of those people respond when you told them?
I do have one memory of a guy that after we met, went on a few dates, and he was done with me.
Yeah.
After that came up and out, which is fine, that's fine. And I always wanted it to be in their court. I wanted them to be able to choose, because it's a lot of work. My husband has a lot of work, to do with when I'm sick. So, especially now that we have a daughter. And so it was if I was upfront in the beginning, nothing was lost.
Right.
And I just felt like if I just did it like that from the beginning, then it would be good to go, and I would just move on to the next,
And I think, we've talked about this too on the show, that one thing that helps people decide to support a cause is that they know somebody with it.
For sure.
And so that's one of the reasons why it's important for people with sickle cell to be upfront about it and tell people, because once they make that connection with you, they're going to be more inclined to help.
Yeah.
And so that might have something to do with this tremendous fundraising that you're doing. We're going to get back to that.
Sure.
Sabae, you are a very persistent and focused advocate for sickle cell, so much so that your passion inspires even me. You've been able to effectively use your passion, your focus, and your persistence to get people to buy into our cause. Would you please share your mindset about raising funds for sickle cell?
I go back to what you just said about the importance of knowing someone who has sickle cell. It changes your perception. You become committed to helping that person because you love them or you care about them. And then you think about all of the other people that may or may not have advocates. But to consider that they don't have help, and the least we can do is to help them. When I was in sales, one thing that they would drill into us was always be closing. That's not the best English, but it's always be closing. Be thinking about signing that contract. Well, my mantra now with sickle cell is always be asking, because you cannot be any worse off if you get a no. But you think, I'll come back to that person. I just need to help them see the need. And the need is great. If we could help people understand that their quality of life is improved by our helping, and it's not left up to someone else to do it, it's important for us to help. I don't like bullies. I don't like people who pick on other people, and to me, that's what sickle cell is.
Absolutely.
It's a big bully.
Good description.
It does not look at who it's going to pick on. It picks on the large, the small, and the young, and the very young. And when I found that 3- and 4-year-old children were having strokes, that just floored me. There's nothing right about that in America. There's nothing right about that. And so many things that we have are issues, but this issue is our issue. And I don't want to run away from that. And I appreciate your saying that this is a Black community issue. It is ours. I didn't know how many people I knew had sickle cell or had family members that had sickle cell until they started to see my name on Facebook with sickle cell. And I started to get messages that my brother died of sickle cell. I was like, I knew you for 30 years. How did I not know that?
Right.
And my cousin and all of these things start to come out. You know that if you care about people, you are motivated.
Yeah, okay. Well, you certainly are, and your passion is coming through very loud and clear. Annette, pretty much the same question for you, because you're also an effective fundraiser. Would you please tell us how you approach your efforts to raise funds for our cause?
A little bit of like what Sabae shared. Ask, and I would say mine's is more awareness. As I approach people, are they aware of sickle cell, and are they aware that money is needed for education and research? And that's pretty much how I attack it from that point. Asking, talking to people. With our upcoming events that we have coming up, I just spoke to a young lady, and like Sabae said, it kind of floored me when she just shared with me a family member that just passed 2 weeks ago. And so prior to that, the young lady had just passed about maybe 5 days prior, and I was like, oh my God. And she said, Annette, it was the complications of sickle cell. She had sickle cell. I was like, oh, I did not know that, again, because
People don't talk about it.
People don't talk about it, and you won't know until you ask. And so that really bothered me that whole day, because as close as we are with sickle cell, and then to be having a random conversation of what's going on in your life, and for this young lady to tell me that her first cousin just passed because of the complications. You know, she went into the hospital, they thought everything was going to be okay, but again, the complication from sickle cell, something else triggered her death. And so from that conversation, I said, well, you know what you could do to honor her is to participate in our upcoming walk. And from that point on, she said, yes, Annette, I will do that. That would be a lovely expression of her, and just to know that we love her and we don't want, just to forget about her. So just think, a conversation sparked me putting together a team, and if I'm not mistaken, that particular team has about 20 members of her family that will be walking in the upcoming.
That's awesome. We need to be sure that we have the name of the deceased, because we do, for those that don't know, we do a balloon release in honor of those that have passed away in the previous year.
Right.
Thank you for that, Annette. You spend a lot of time with elected officials, and you've been able to get some of them to buy into our cause. In your words, why is it important to have elected officials on our side?
Oh, I mean, that's a really good question. Again, it's about educating them. They're the ones that are at the forefront, that can make legislation. They are able to make laws. They're able to bring funding to your particular state, cities, and so that's one effort that I like, or that's her approach. I mean, and it goes far as lobbying. With me being, involved with a lot of the elected officials, I'm able to talk to them on a one-on-one basis, a more personal base, and build that type of relationship that I think is needed for the Martin Center Sickle Cell. So that's one of the areas that I'm going to work very hard at as well. And
we were actually just talking about that before we started the show. We're not going to name any names about who you're going to talk to next.
Right, I have 2 people on my list already. Again, Gary, just by conversations, because I did not know that. And, what we shared a few minutes ago was really disturbing to me. And I said, I'm going to get right on that immediately to change that.
We were talking about the fact that Representative Danny Davis in Chicago has introduced legislation to provide additional funding to the federal sickle cell budget, among other things, for the purposes of establishing a comprehensive sickle cell centers, one of which we'd like to have here in Indianapolis, and doing what we can to try to get that. And we have asked a couple of our local elected congressional people to sign on, and they have not done so far, and that's what we were talking about. And Annette just said, well, I'm going to talk to them, and that's what we need. So thank you for that. And we're going to ask Jami a question, then we're going to take a break. Jami, this is definitely worth a round of applause, because to our knowledge, I'm getting ready to give you the kudos here. You're setting an all-time record for fundraising in the 20-year history of our annual Sickle Cell 5K Walk Run. And you have single-handedly raised close to $3,500 in just a few weeks' time.
I'm trying.
And you're doing. I've never seen this before. And when it started, it went from zero to like $1,800 in a few hours. That was blowing it away, and we don't understand what you did. So, what are you doing to be so successful?
I mean, really, it just social media is a rock.
Yeah.
I have, and like you said, with the fast amount in such a short time was social media for sure. And I
mean, we were starting to think there was something wrong with the system. It's like, okay, because we've had things like that happen before, but it's real. It wasn't.
No, it's definitely real. I have a list of names. The list is on the webpage, but yeah, it really. It's flown by. I have a goal, and I'm trying to achieve it. And even when I first started, it was like, okay, let me top my prior years, right?
Which was good last year?
Yeah. Let me try to do 3,000. And then within 2 days, I had hit, that amount of like 1,800. I was like, okay, 3,000 I might hit that really soon.
It's possible.
So let me dream bigger. And so now my goal is definitely 5,000 by the walk. But I'm just social media.
Social media
has been good for me.
And there's something about the way you work social media too, so don't
True.
not give
True.
yourself credit.
Yeah.
Thank you for what you've done. We
Yeah,
appreciate it so much,
for sure.
and it's helped set a model for other people to follow.
Mm-hmm.
We're going to take a break, and when we return, we'll continue our discussion with these three delightful ladies. This is the Sickle Cell Action Network, and I am Gary A. Gibson, your host. Welcome back to the Sickle Cell Action Network. We are speaking with Sabae Martin, Annette Johnson, and Jami Fox, and we are talking about raising funds for sickle cell, which is a very, very important thing and something that is actually kind of hard to do. And I tell people all the time that I hate asking people for money, and I really mean that. And as the treasurer of our organization, Sabae, would you please tell us why fundraising is so very important to agencies like ours?
Sickle cell is a challenge that everybody has an idea of what the illness does to your body, but it doesn't translate into everyday life as quickly as when you have a crisis. We forget that people still have light bills, they still have phone bills, they still need to get children to school, they still have needs. They still need to hydrate, they need to get to the doctor. They have things that are not always addressed by the usual public services, the grants and funding and that kind of thing. We have, and I heard one pastor say this, if every church, every black church in Indianapolis, and I say that because it's a black disease, people don't like to say that, but sometimes we just need to keep it real, would just do a little bit more, just a little bit more, $1 more every month per person, it adds up, and it's taking care of our own. And it gives us credibility when we take care of our own issues instead of always looking outward. I think it makes us more cohesive when we take care of our own issues. And that's why I don't have a problem asking anyone to help someone that really needs help. And it is something that we should not have to qualify someone for, other than they have this challenge and we need your help.
You know, I sometimes see like the ASPCA commercials on TV, and you know, they are able to move people to give money for pets. And no, I don't have anything against pets, so don't get me wrong, but they are able to raise tons of money for pets. We're talking about people and people's lives here, and it is just, if we could have a fraction of the money that ASPCA raises for pets, we wouldn't have to ask for money anymore, because of how we operate. And another thing that I like to tell people is that when you give your money to all of these other causes that are out there, and there is no end of the causes that you can give your money to, but a lot of the causes that people are giving their money to actually maybe don't need that money because they already have so much.
That's true.
I was speaking to a person one time who runs an agency here in Indianapolis, and it's an agency excuse me, that's devoted to helping people with AIDS. And he was telling me that he was hiring not a new social work, he was hiring a psychologist to help some of their patients. And I said to him, you know, that's something we'd like to have at Martin Center too. And I said, so where'd you get the money? And he leaned over to me. We were in a big room, and he leaned over to me, and he said, I'm almost ashamed to tell you. And I said, what? This is a true story. I said, what are you ashamed to tell me? He said, I have more money than I can use.
Wow. Oh my God.
He said, Gary, this is AIDS. He says, I get $8 million from the federal government, I get several $1 million from the state, and I get unlimited contributions all day long. And I said, man, I wish I had your problem.
Wow.
And so what my point is that those that might want to give to AIDS but also know that there's this other illness called sickle cell disease, no offense to AIDS, and they probably won't like me saying this, but they have a lot of money flowing there, and we don't. And not only us at Martin Center, I'm talking about sickle cell agencies all around the country. There's about 41 of us that are SCDAA chapters, and we all face this same issue. We're all trying to scrap and find money to be able to provide our services. And you got organizations over here that are dealing with AIDS, breast cancer is another one. They just get so much money. And I'd like to tell people that $1 spent with us is going to go a whole lot farther than $1 you spend with one of those organizations. It's the truth. So I'm glad you mentioned that.
One of the things that Annette and I focused on when we came together, and it was a joint venture, we both were active in the community, we know a lot of people, it was lifting the conversation, changing the conversation and getting it outside of the usual walls, to get it in other communities so that they're speaking about it in Carmel and in other small cities, Bloomington, and other cities around Indiana and around the country. You have to change what you're talking about, and as long as we keep it under wraps in our community, it won't grow. It needs to come out of the box and let the sun shine on it so that we can see that the need is there. And that was also something that we looked at when we put together Zumbathon. We wanted to diversify it. We wanted it to be something that everybody could come to and everybody could support. And that was the one thing that crossed all barriers.
Right. Thank you. Annette, as a member of our fundraising committee, you are working to help us put on a number of events over the next few months. And Sabae just sort of gave a teaser for one of them. Would you please share some information about those events and the things that you and our committee are working on?
All right. Thank you, Gary. Well, we as our fundraising committee, we thought it was important, and pretty much touching basis of what you just shared, that we have something going on monthly. And that was one of the things that we came together as a fundraising committee, where we could have something going on every month, so that we do not keep it under the rock or keep it, like Sabae said, we want it to be out in the open about sickle cell. So our upcoming event, which is Saturday, June the 11th, we're very excited about this. This will be our 3rd annual Sickle Cell Zumbathon. And so we're very excited. We've been able to partnership with Eskenazi Health Center. They're allowing us to have the conference room area that the Zumbathon will be going on at no charge. And if you know what fundraising, that's what we love to hear from people when we
And you mean
go
no
out.
charge for the facility, but it's a charge to participate.
Yeah, charge to
Right.
participate, yes.
Donation.
The donation is $10.
Right.
And of course, all the proceeds will benefit the Martin Center Sickle Cell Initiative. But again, it's our 3rd annual Sickle Cell Zumbathon, and it's going to be held over at Eskenazi Health Center, and that's located at 720 Eskenazi Avenue. And for people that are here in Indianapolis, it's always been 10th Street, so that may help. The time for the Zumbathon is, it's a 90-minute session, so it's noon to 1:30, and we ask that you arrive about 11:30 so you can do the registration. But again, it's our 3rd one. Me and Sabae thought this would be something where we could reach across the aisle, include all diversity in it, and so we're excited.
And we have 4 or 5 different Zumba instructors
we
that are
have
donating
5.
their time.
Yes, they're donating their time and energy.
And we appreciate that so much. We appreciate them.
5 instructors.
Okay, so after Zumbathon, what's next?
Well, the 20th.
The 20th
Our
annual?
20th walk anniversary. So we're excited about that. That's going to be held June the 25th. And we do the Zumbathon to kind of get the word out of what's coming, because the walk is 2 weeks afterwards. So again, it's June the 25th, and it's at the Riverside Family Center, and we're starting at 8 a.m. and it's a 5K walk and run. So if you don't want to run, you're more than welcome to walk as well. And again, all the proceeds benefit our Martin Center Sickle Cell Initiative.
And we're very happy to announce that our Grand Marshal for the 5K walk run is Pastor David Hampton, who is pastor of one of the largest churches here in Indianapolis, Light of the World Christian Church, and he is also deputy mayor of the city of Indianapolis. So we're very, very happy to have his support and courageous efforts. He ran last year. I'm not sure if he'll run this year, but he definitely did a good job too when he ran.
Yes, it is.
And after the walk, there's some other things we got coming up, right?
Well, yes, we have a wine tasting event that we're working on. That will be in August. We also are doing a dine-in and donate, and that's in September, and that was pretty well attended, and that's going to be at Maxine's Chicken and Waffles. And we also have another dine-in and donate, which I'm very excited about this. We just got the word about this one, and that would be held at Granite City. And I'm excited about that one because they're offering both their locations for us to be able to have, proceeds. And because they have one downtown, of course, and then they have one in Carmel. So this way we can have people from various portions of the city be able to participate and not just confine it to just one area. So I'm excited about that, and we'll have information posted on our website. But we have so many things that we're doing, and again, we're trying to do things once a month so that we can keep sickle cell out in the community and let the community know that we're here and that we're working as diligently as we can to raise money. And as Sabae mentioned, you have to have money. You just cannot be able to do everything without any money, and our clients definitely need the money.
Well, that's very good. A good rundown on the events that we got coming up.
And I think Sabae may have something to add. Did you?
Just wanted to say that we're excited about events that we have planned even into the beginning of next year.
Yes.
Our focus is to continue to have ongoing fundraisers, again, to lift the conversation, to get a big conversation started in Indianapolis, because great things are happening around us in the sickle cell world.
Right.
Research and funding, and things are starting to change.
Things are changing.
But we still need everyone's help.
Well, I think that is very well said. We still need everyone's help. We're going to take a break, and when we return, we will continue our discussion with Jami Fox, Sabae Martin, and Annette Johnson. This is the Sickle Cell Action Network. I'm Gary A. Gibson, your host. Welcome back to the Sickle Cell Action Network. We're having a great discussion about fundraising for sickle cell. And a few moments ago, we talked about our schedule of events, fundraising events that we have coming up in 2 points. One, some of you that are listening are not in Indianapolis, and so maybe it might not be possible for you to attend these events, but certainly want you to know that you can go to www.themartincenter.org, and there is a donate button right there on the front page, and we always say any amount is accepted and appreciated. So you might want to do that to help us in our highest fundraising season right now as we prepare for our annual walk. So keep in mind that www.themartincenter.org on the front page is a donate button. But the other thing we wanted to add is that we also are going to be doing something very unique on June 17th. And that event we're going to call Popsicles for sickle cell. And we have a group of volunteers that are going to go down to the center of Indianapolis, downtown, stand on the circle. For those of you that have heard Indianapolis called the Circle Center, Circle City, is because we have a circle right in the heart of downtown with a big monument on it. And we will be standing on the monument handing out free popsicles to people that come by. It's a very busy thing at lunchtime, and we hope to hand out at least 500 popsicles for free. And we're doing that to raise awareness for sickle cell because June 19th is World Sickle Cell Day, and also a week after that we're going to have the walk. So we're wanting to raise attention and awareness to World Sickle Cell Day, and also to raise awareness and interest and possibly registrations and donations for the 20th annual Sickle Cell 5K Walk Run. Is there anything you wanted to add to that, Sabae or Annette?
Other than this is again a part of our effort to increase the conversation, to get people talking about sickle cell, to promote the walk so that we can grow the walk. Last year was our largest walk ever. Last year our now sitting mayor ran in that walk.
That's
and
correct.
The deputy mayor. So we are growing, but we still need to grow some more. We are very excited this year that we have 3 pre-events before the walk, which is Zumba, Popsicles on the Circle, and
It's 2 events.
the Zumba.
Zumba, yes.
Yes, Zumbathon.
Okay. All right. Well, thank you for that. Jami, let's come back to you. In your words, why should people support sickle cell?
You know, I've been thinking about that. And what I think about is why not?
I like that.
Yeah, like why not? Why would you not support something that is so detrimental and terrible to people in general? You know, like why would you not support it? And I really don't even know like how much more to say, because there's so many other things people support and so many other diseases people support, and I just feel like as much as we're trying to get the word out to get the support that we need, that the biggest thing is why not? Why would you not support it? And like you said, like no donation is too small, so why can't we get, you know, why shouldn't we get more help? And we need the help, clearly. We need it. So, you know, especially with the people that you know that have the disease, I would just hope that, you know, people would donate for the disease, for the fundraiser, you know, because it's such a detrimental disease.
You know, there are a number of services that we offer, and some of those services we're able to offer and other agencies that help people with sickle cell cannot offer because they don't have enough funding. But even with what we can offer, Jami, there are still other services that we want to offer that we think would be beneficial, but that we can't afford to offer. And I think, Sabae, you kind of touched on it a little bit earlier. It's like even educating people costs money. And people might say, well, what does it cost to educate people? Well, think about, you've got to have somebody that's an educator that knows what they're talking about, and typically they don't do that for free. They need a salary.
Right.
But you also hand out literature, and you know, people do not generally donate the literature.
Right.
And those kinds of things. So even just in the field of the area of education, it costs money to educate. And you know, if we want to drive around town, we got to pay for gas, we got to pay for parking, those kinds of things. So it takes money to do anything we offer. But the other thing that we want people to realize is that as we look at the needs of those people that have sickle cell disease in general, they cross the whole board. And people need help with all kinds of things, and it's just not enough funding going around to help with everything they need. So we have to kind of pick and choose and say, this is what we can do and this is what we can't do until we get some more money. So again, this is why we do what we do. Sabae, I'm going to ask you the same question. Why should people support sickle cell organizations like Martin Center?
Gary, why should people support organizations like the Martin Center? The Martin Center has supported sickle cell for a very long time, and it's done so on its bare bones, so to speak. We work very hard, or Gary works very hard every year to keep our funding up. But our funding is always
just enough.
Yeah, just enough.
Just
we
enough to
barely
do just
keep
a
our
little. Yeah.
head above water, and when we get our head above water, we really cannot relax, because under the surface of the water, we're still treading to stay there. So it's important to give to cover us during the times that we may have a dip in funding that we typically can count on.
Okay. Let's take another break, and then when we come back, we'll continue the discussion, start wrapping up. But it's been a great show so far. Hope you're listening. Hope you're enjoying. This is the Sickle Cell Action Network. I'm Gary A. Gibson, your host. Welcome back to the Sickle Cell Action Network, and we are speaking about raising funds for sickle cell, and we actually asked Jami Fox to give us an answer as to why people should support sickle cell organizations, and then we asked Sabae Martin. Now it's Annette Johnson's turn, and Annette, you're on the spot. You got to come up with a better answer than the one Jami gave us.
Well, I was going to say because the support is needed, and as if you know, the listeners that are out there, I would beg of you to go to the Martin Center website. You will see all the programs and services that the Martin Center here in Indianapolis does or tries to do for their clients and their families. It's a nice list. So if you go to the website and you're actually able to look at services, we need money for it. I mean, just me going down the line: health education, outreach program, the newborn screening, follow-up programs, client and family support services. I mean, the list can go on and on. So that's why it's important that we have donations and people give back, because it's much needed, and there's just so much that, again, the Martin Center is trying to do for our clients and families. And again, I mean, I can just go down the line. A lot of times we don't even think about scholarship programs for the younger adults. I mean, they want to go to college, as Jami shared with us. Just because you have the disease, that doesn't mean that's the demise of you. You may, hopefully, God's willing, you'll grow to adulthood. So just imagine students and clients that want to go to school. So we offer scholarships for that. We have the food pantry. I mean, again, the list on the website is very large. So again, that's why the donations and the funding is needed.
Thank you. Very good answer. Very good answer. So let's get real here. We do face a lot of challenges when it comes to raising funds, and one of those challenges, and perhaps one of the most daunting of those challenges, is that there just isn't a lot of money in the hands of those who are affected by sickle cell. So in other words, since it is an illness that affects mostly people of color, and that in general people of color are not as well positioned financially, socially, economically, etc., that it's difficult to expect to get money from them. So I'm going to ask each of you, in your opinion, what are some of the other challenges that we face when it comes to that? Let's start with you, Jami.
Okay, so what are the challenges?
What are the challenges that affect our ability to raise money for sickle cell?
I would say,
Like lack of awareness, eh?
yeah, okay, so I would say, you know how, like, for other fundraisers, like other diseases, like, for instance, breast cancer, like, it is so huge, right? On the TV, on, like, we don't have that.
Right.
And I feel like that is another struggle for the community as in for funding, because we don't have, like, our name and our disease isn't out there. And so it's all by word of mouth, like, but why? Why is it only by word of mouth? Like, why aren't we huge enough to be able to raise enough money, just like the next disease? And I think that's a huge challenge, is because we're not out there like other diseases.
Okay.
Which probably, because of it being a black disease, that's part of the reason, which is awful.
It's awful, and it's not very well founded anymore. We'll talk about that. What about you, Annette? What do you see as some of the other challenges that are in the way?
Pretty much what I shared earlier. I would say education. The more that you share and people know, then that brings about awareness. But it's sometimes when people don't know, they don't feel like, why should I give to something that I have no clue about, or I don't even understand it? So I would say that's one of the challenges, is the educational piece, and that's why I wanted to jump on board with, being an educator. I'm able to talk it up, I'm able to share, and that particular teaching mode is automatically instilled in me. So
Right.
I'm able to just freely, it just flows pretty much, I would say, off my tongue. And I noticed that, again, the various organizations that I'm involved in, I have just brought about a whole wealth of knowledge and awareness. My sororities that I'm in, just by saying at our meetings, can we donate to sickle cell? They were like, and that's a great idea. I mean, but again, if you don't throw it out there to people, how would they know?
Right.
So that's how I look at it.
Okay. Sabae, you have any additional thoughts?
I think we have to get over the stigma. I think we have to stop
Yes.
looking at it as a negative. One of the first things that I really enjoyed in the first conference I attended, listening to the panel, was patients that have their testimony about their lives and they have negative aspects, because that's their reality. There's nothing wrong with it. That's their reality. But at the same time, we have patients that are graduating college and
Right.
that are as successful in their careers and the positive aspects of their lives. Those are the things that we want to talk about more, because people like to be involved in things that are positive.
Right.
And if we change the conversation and we stop focusing on the negative, I think we'll start to find that people are more willing to give to the positive. So remember, at one time, that talking about cancer was not a popular thing to do.
Nor was AIDS.
Kept under, nor was AIDS. It was kept under wraps. But they changed the conversation. As someone suggested, maybe make it a little more, I'll say, fun. They used a different word.
Yeah.
But you have to make it pretty and appealing for people to be able to digest it. And I
Okay.
think we're having to change our messaging.
I like that, and I think that's appropriate. One thing that none of you mentioned is the celebrity advocates that, always seem to make such a big difference. And when you think about the success of the ALS challenge last year, it was driven by so many celebrities that
That's
were a
true.
part of it, and then putting it up on social media, challenging others.
Sure.
We don't necessarily want to replicate that, but it takes that kind of thing, unfortunately, in my opinion, unfortunately, for people to recognize that there's a cause here that's worth their attention.
Yes.
People tend to like to follow others, and so if there are people that are leading the charge that have that type of pull, then we could get there. So we do have a few celebrities in the sickle cell field, but we don't have enough, and those that we have, I think they're sort of limited in the abilities that they have. But that's definitely something that I think is also a challenge.
Absolutely.
Along the same line of challenge, and this is what kind of concerns me a lot, is that we now know that there is more wealth than ever before in the African American community. And we've been talking about how this disease, at least here in the United States, affects mostly African Americans. And so with that being the case, that there's more wealth in the African American community than ever before, what are your thoughts on how we can get some of this wealth directed towards our cause? Jami?
I think first and foremost, I am biracial, and with my success with the fundraising, I have a broader amount of people that I know that are Caucasian,
Right.
and so just asking them is what I've been doing, and I think that Caucasian, African American, whatever the case may be, but because I'm biracial, my circle is very diverse, and so it's been pretty easy for me to send a quick message to someone and to be able to get the help. And so I think that has been definitely easier for me than it would be for someone that doesn't have a broader range, of people to talk to. So
Right. Okay.
it's been
Annette, what about you? What can we do to get some of the wealth that's in the African American community directed towards sickle cell?
I would say I'm going to use methods that I use in the political arena, and that's grassroots.
Right.
So I'm going to be out in the community speaking about it, hosting events that would pertain to that particular community or that particular area. I'm part of a sorority, again, working on getting them more involved, because as a sorority we have causes that we want and will donate to. Again, they did not know, as me being a new member of that particular sorority, they're like, yes. And I'm part of a professional organization as well, and that has helped me to be able to, I would say, jump right in. And sometimes it helps when you just jump right in and you already have a cause. You don't have to put too much thought in it. because I know it has worked for me. I'm like, I have a cause lady that we can give to, sickle cell. Okay, Annette, let's do that. I mean, it sounds kind of funny, but sometimes they're like, that way we don't have to think that much. Annette already has something for us. We'll go that route and we'll do it that way. So I would say working through the grassroots elements of it, and the sororities and the professional organizations that I'm involved in, I get on a committee, and that particular committee is given to me, and I'm able to open that door and pretty much, go with that pathway of, getting funds.
Getting those doors open and following the path.
Yes.
Sabae, do you have anything else you'd like to add?
When I look at who I've approached for donations, the greater number of funds come from our black churches. If there was some way to get more of our churches to give to this cause, we could address this mission here in our own backyard. Black businesses, the other supporter that I can always go to, the private individual may not have funds that they can give on a considerable scale, but we have black businesses in our churches that we hope will do what they can to support sickle cell.
Right. One thing that I think about, and I talk about this at some point in some of our meetings at our office, is that, we sit on a very busy street. And as we work in our offices, there are thousands of vehicles passing up and down that street every day. We don't really pay attention to the noise. We're accustomed to it. It's like white background noise, like the air conditioner in a room. You just don't pay attention to it. But every now and then, a fire truck or a police car goes by with the sirens blaring, and somehow that gets your attention. And I think that's what we have to do with sickle cell, is somehow we have to be a siren. We have to have the sirens blaring in order to get people's attention. One thing that I think helps with the sirens blaring, Jami, you sort of touched on in a way, by admitting that you're biracial. And that sends a subliminal message to others that, you know what, if she can have it, then maybe I can have it. Or, wow. So one thing that I've seen, I've done a lot of studying on this, and one thing I've seen is that people tend to give where they have that connection.
Right.
They also tend to give where they have a fear. So that's one reason why you see so much success with fundraising for things like cancer and breast cancer and AIDS. Those are all either contagious or possible that you can get it.
Possible.
Mostly those that know anything about sickle cell know it's not contagious, so you can't get it. But if you can expand the vision to say, you know what, it can be in your family,
Could be.
and maybe you won't get it, but it can affect someone you love. That's a message we have to start sending too, and that's the siren. And I think that we've got to turn up the volume of the siren in order to get some support there. We want to ask a couple more questions, and we're going to wrap up here. So, Jami, is there anything else that you'd like to add to what's been said so far today, other than that most impressive and most powerful, why not give?
I don't know. I just think that, there are a lot of people that need to be educated more, and to get the education out there is to receive more funding too, and to receive more help, and so I just think if we can continue to advocate and educate, we will get there. It's just all a work in progress. And
Just one thing is that we didn't say yet is we're sort of caught, Martin Center and the other sickle cell agencies, we're sort of caught in between a rock and a hard place, and that is we don't have enough money to advertise. And, as we've gone through the years, those entities that used to do public service advertising on TV and radio, they don't do free public advertising anymore. So if you want to get your message out, you have to pay. And of course, we were able to, because of a certain grant that we just got, we were able to do some radio advertising to help with the grant. and it cost us $4,000 to do 24 spots. That's as much as we can do, but we had to have somebody else's money to be able to do that.
Right.
So how do we get the word out if we don't have enough money to pay for advertising? And that's the catch-22. So people say, well, I didn't know that you existed. I didn't know about sickle cell. Well, that's because I wasn't able to tell you because I didn't have any money to give to advertising companies to put it out there. So
tough.
Yeah, it's tough. It's a catch-22, but that's where we are. Annette, do you have anything else that you'd like to add?
I just wanted to share that we have to do more with, what we have in our community. I like the fact that the Martin Center Sickle Cell Initiative is right in the community, and like Sabae said, right in the African American community. And it's like a small secret that a lot of people in our community do not know about. So I would hope that, today's show would spark some interest out there. We could get people to come out and volunteer and send some donations. So I just wanted to, kind of add that and make that particular plea of why it's so important that we support what's in our community, what's our own with the Martin Center Sickle Cell.
Annette? Sabae.
That is absolutely true, and it's always been the path that we've walked on to make it a bigger conversation, to bring more people in. When we have a larger conversation, we'll have a greater pool of money to pull from. I think we're on our way. I think we're not where we were 4 years ago, but we're nowhere near where we need to be, but we're making great progress.
Right.
There are, as you stated, some celebrities that have taken on the cause of sickle cell, and we hope that there will be more as we move forward. But the longer we talk about it, the louder we talk about it, the siren effect will take place. And I'm positive about that.
Thank you. I think, this has been a good show, and hopefully those that are listening get something from it. Recognize, number one, that it's important to raise funds so that we can provide services to others, but also to recognize that it's important to continue to spread the awareness. And as I say in my introductory statements, raising awareness is good. Awareness is good. It's important, but it's not all there is. And sometimes we think that there's people that tend to think, oh, yeah, okay, I'm aware. Now what? And I want to say, well, no, that's not where it ends. You have to turn that awareness into some action. And that action is what actually ends up helping people. And trust me, people that live with sickle cell disease, depending on what sickle cell has done in their lives, and each individual patient with sickle cell is different. We've talked about that quite a bit. But depending on what's happened in their lives, they have different needs. But everyone with sickle cell has some sort of need, and that's what's important for people to understand. So we hope that you are able to, and say this too, that if you're not able to give money, you can certainly work on somebody that can. And need to get them aware and to try to get them to become a little bit more concerned and compassionate about this issue. And if you do that, then I believe that we will see some more progress. And when that progress, the result of that progress is more support to people that are living with sickle cell disease. That's our ultimate goal. Would you all agree with that?
Yes, absolutely.
Yes, absolutely.
Well, we're going to go ahead and close out the show, but I'm going to thank you, Jami Fox, for being here today.
You're welcome. Thanks
Pleasure
for
to
having
have
me.
you, and you keep up what you're doing.
Yes.
$3,500 in raising funds just by one individual for our 20th annual walk, setting a record as you go, and I don't think you're done yet. Annette Johnson, thank you for being with us today, and thank you for being the chair of our fundraising committee and making it happen and keeping things going. Appreciate you so much. And Sabae Martin, our treasurer, thank you so much for what you're doing as treasurer and as an advocate for sickle cell disease. It's great to have all of you here. So we close out the show, and as always, we do that with the thought for you to consider as we go away. And our thought today starts with a closing quote from Arthur Ashe. Arthur Ashe said, "You've got to get to the stage in life where going for it is more important than winning or losing." Once again, you've got to get to the stage in life where going for it is more important than winning or losing. Arthur Robert Ashe, Jr. was an American world #1 professional tennis player. He lived from 1943 to 1993. He won 3 Grand Slam titles, ranking him among the best tennis players from the United States. He was the first black player selected to the United States Davis Cup team, and he's the only black man ever to win the singles title at Wimbledon, the U.S. Open, or the Australian Open, and he retired in 1980. So last Sunday, approximately 400,000 people jammed into the Indianapolis Motor Speedway to watch and participate in the 100th running of the Indianapolis 500. It was a picture-perfect spring day to have what was called the epic race at the epic place. Now I know that many of you may not be race fans, but I do think that there is at least one important lesson that came out of watching those incredible 220-mile-an-hour missiles speed around the track to go 500 miles in a little over 3 hours. The finish of this year's race was actually kind of a letdown when compared to the photo finishes that the race has produced in recent years. Instead of finishes in which the winner edged out second place by mere inches, this year's winner, Alexander Rossi, won by a whopping 4 seconds. In IndyCar terms, that equates to a distance of somewhere around 1,000 feet. During the victory celebration, Rossi said, "I have no idea how we won this race." So what's the lesson, you ask? Well, the first thing to know is that Rossi was a rookie. It was his first time ever racing at the Indianapolis Motor Speedway, and only the second time he had ever raced on an oval track. Don't get me wrong, Rossi is a racer, but his roots are on road courses. He is the first rookie to win the Indy 500 since the year 2000. In other words, rookies winning the Indy 500 are a very rare phenomenon. So, here's the lesson. It's in the way that Rossi won the race. He followed orders, and he won the race because he got great fuel mileage. You see, as a rookie, Rossi didn't really know what he was doing. Sure, he knows how to drive a car, but driving a car fast at Indy is a very difficult task that few people can master. What helped him is he had very experienced and knowledgeable race engineers talking to him on his radio, and he did everything they told him to do. He charged when they told him to, and he coasted when they told him to. That's how he won the race. There was a point around the 160th lap of the Indy 500 where one of Rossi's engineers said, "We're just going to go for it." That's what they did, and this time it paid off big. The other leaders had to stop and get gas, and Rossi just kept going all the way to the end. What's it got to do with sickle cell, you might ask? Here's what. As we meet and talk with doctors who treat people with sickle cell, we often hear them say, "I wish we could get some patients to be more compliant. If only they would take the medicines like hydroxyurea that we prescribe, they might be able to stay out of the hospital. If only they wouldn't overexert themselves or drink the wrong beverages, they might feel better for longer periods of time," they say. Now, certainly, most sickle cell patients aren't rookies like Alexander Rossi. They've been living with sickle cell all their lives. However, there are some who aren't listening to their doctor's orders, and they are paying for it by experiencing more frequent crises, more anemia, more organ and tissue damage. The doctors are like Alexander Rossi's race engineers. Following their orders might just let you pull into victory lane as a winner. After all, even one less crisis is a victory. That's our show for today. Please join us next week, same time, same station.